Hi, welcome to Willow Wellness Clinic. I'm Dr. Cecilia de Martino, and thank you for watching this video before coming in. I want to talk a little bit about my practice and what to expect. I bridge both the evidence-based aspect of medicine, so taking a thorough health history, physical exam, and lab testing, but I also use energetic medicine, intuitive medicine to better come to a conclusion as to the best course of action and what may be going on. In the energetic aspect of things, it does involve a little bit of muscle testing. I don't use it to diagnose, but I use it to be a little bit more specific in my recommendations, and I can show you what that's like when you come in. For the evidence-based aspect of things, I want to talk about blood testing. So you can get blood work done through your family doctor. Most tests are covered under OHIP, which is great. The one test that is not covered under OHIP is vitamin D, unless you have osteoporosis. Usually it's about $35 or $40 to get that done, but I do recommend it. My recommendation is to get some blood work done within the last year, ideally. So you either have the option of going to your family doctor and asking for some blood tests, and I'm gonna talk about specific ones that I look at the most. Or we can do that privately. I can send you to Life Labs with a requisition form. You would pay here, and then with that form, you would go. It's just not covered by OHIP. So I just want to talk a little bit about the specific blood tests that I do most commonly test. Of course, there may be some add-ons based on your condition and your symptoms. So I created a handout which you will receive when you come in, basically outlining the different tests. So the first one here, CBC. CBC is complete blood cell count. It looks at your red blood cells, at your white blood cells, and it's really a good, very basic type of test to get done. The next one is vitamin B12. Vitamin B12 is a common deficiency. Sometimes we're in the normal range, but we're not optimal. So getting that looked at, especially if you have some fatigue, is really important. Then we have ferritin. Ferritin is stored iron. And it is important, especially for females who are menstruating, to make sure you're not low, but it's also important in males and females to make sure you're not high, because that can also be very bad. You don't want to have too much iron in your system. Vitamin D, as mentioned, it's not covered by OHIP, so whether you get it done through me or through the system, it's still about $35 to get done. And then, cholesterol and sugar levels, usually the family doctors are very good about keeping on track with those. So if you have any of those results, bring those in. Thyroid is also important because it's involved in so many aspects of the body. It can lead to constipation, diarrhea, fatigue, difficulties losing weight, or hair loss. So looking at the thyroid function is important, but also making sure that you're not just in the normal range. Again, we want to make sure that you are optimal. The medical system often only checks TSH, which is thyroid stimulating hormone. This is the signal that the brain sends to the thyroid, but it's not the full picture. We also want to know what the thyroid itself produces, what hormones it makes. Those are your free T3 and free T4. We also want to look at antibodies. Is your body attacking your thyroid? That more thorough thyroid panel is often not done through the medical system, unfortunately, but we can do it privately, and I do highly recommend it if you have certain symptoms, but even just to make sure that everything is going well. And then things that sort of would be nice are things like the liver, enzymes, as well as kidney function, depending on your age. There are also other tests that we run in our practice. Food sensitivity testing. This is also done through Life Labs, where it looks at what your body's reacting to, and then we would eliminate those foods accordingly, and it looks at different food groups. Lots and lots of options there. And finally, one of my favorites is a hormone test. It's called the Dutch dried urine hormone test, where it looks at the metabolites of your hormones. So it looks at estrogen, progesterone, testosterone, melatonin, cortisol, adrenal function, and then how it's all broken down. And this is really valuable if you are experiencing any type of hormonal imbalances. It's gives us a lot more information than just blood work alone. So this is just an overview of what is possible, and so when you come in, we can discuss these options a little bit more thoroughly. But I do appreciate you taking the time watching this. I will be creating more in-depth videos on these individual testing as well, so you can take a look at those. All right, well, again, welcome, and hope to see you soon. Thanks.